Several patients in the prisons painfully trudge the corridors of health facilities in hope of a cure for their ailments. Catching diseases like tuberculosis is not part of the sentence for those confined in Uganda's prisons, but more and more this seems to be the case in these reformatory facilities countrywide. Studies done at Luzira prison show that for every person catching or at risk of catching tuberculosis outside prisons, 2 inmates are likely to get infected with the TB bacteria.
The prisons in Uganda are overcrowded, and that therefore means that there is a transmission of the infection.
Of the 223 prisons all over the country, only Upper Luzira, Gulu and Fort Portal have tuberculosis screening services, an initiative supported by the International Red Cross Committee under a pilot study. And only 48 prisons in Uganda have functional health units. Of these, only 6 have laboratories to detect tuberculosis.
The prisoners, if they are not treated, eventually they return to the community and therefore infect their relatives. Or when visitors come to see the prisoners, then they can easily pick the infection from prisons.
The entire prison's health services operates on about 350 million shillings and spends almost half of this on essential drugs. Prisons officials say a tripled amount would be able to boost the prevention of diseases, treatment and care for prisoners. Today, the national activities to commemorate the World TB Day were taken to these grounds at Luzira prisons in recognition of the impending doom that could spell a major crisis from the increasing cases of TB in these confined walls. Prisons officials are now calling on the government to equip their facilities with laboratory equipment to detect TB in prisons, especially at entry, as well as strengthen the health service delivery in here to improve the lives of inmates, as this is their right, not a privilege. Leah Bwanika, NTV 11.